If you're a horse owner, now is the time to consider vaccinations. And joining us is Dr. Amanda House of the University of Florida College of Veterinary Medicine and Dr. Craig Barnett of Merck Animal Health. Thank you both so much for joining us today.
Thanks for having us.
Yeah, thank you.
Of course. So very important topic here. We want the health of our horses. And so the first question I have to ask you is, what diseases should owners really be concerned about?
Great question. Some equine infectious diseases are significant enough to justify vaccination for every single horse every single year. And these are called the core equine vaccines as defined by the American Association of Equine Practitioners. And the core equine vaccines protect horses against Eastern and Western equine encephalomyelitis, tetanus, rabies, and West Nile virus. Now, the clinical signs and symptoms of these diseases can vary somewhat, but mostly they cause neurologic symptoms, which can be devastating for our horses.
Yes, and in addition to those core vaccines, we have what we call risk-based vaccinations. And the decision to give risk-based vaccines is determined by the risk of that particular horse contacting that disease. Equine influenza virus and equine herpes respiratory virus are two of the most common risk-based vaccines that we give to horses, and we commonly administer those vaccines to horses that travel or in frequent contact with other horses because they're at increased risk of contacting infectious and contagious diseases. We recommend that horse owners consult with their veterinarian about which risk-based vaccines they should administer to their horse. And they can also go to the American Association of Equine Practitioners website, which is aaep.org.
Right, and you mentioned influenza very briefly. Should horse owners be concerned about horse flu in the same way that someone would be concerned about a human flu?
Yes, good question, very much so. We've seen a lot of influenza in horses across the country the last few years. Influenza in horses, like in humans, has a tendency to change or mutate over time. At the Merck Biosurveillance Respiratory Program, we've been monitoring these mutations or changes over the last few years. And the last few years, we've seen a significant change or antigenic drift or significant mutations occur, resulting in a lot of influenza outbreaks across the country, even in well-vaccinated horses, highlighting the need to update our vaccines. During one of those big outbreaks in Florida, we isolated a highly pathogenic strain called Florida 13, and Merck Animal Health put that Florida 13 strain in their prestige influenza vaccines to help provide better protection to the horse through a very current and relevant strain. And you can find out more information about that vaccine at prestigevaccines.com.
Excellent. Now, besides vaccination, what other considerations for equine health should the owners of these horses be concerned about?
Absolutely. In addition to vaccination, good biosecurity management practices are absolutely critical. And that includes things like taking your horse's temperature daily, as a fever can be one of the first signs of an infectious disease. And then, of course, good hand hygiene. So washing our hands really well with soap and water in between contacting different horses. There are a lot of other great recommendations for biosecurity management on the website equinediseasecc.org.
Well, they are just such gentle giants for a lot of us. They are our babies, and so why wouldn't we want to take the best care of them that we possibly can? Thank you both so much for this essential information. It really is enlightening for a lot of people and their horses.
Thanks for having us.
Absolutely. Stay right where you are. We'll be right back.